Welcome, ladies and gentlemen. My name is Nathan Mai. I am a part of BSN 007. Today, my presentation and my project proposal is going to be on HAIs, also known as hospital-acquired infections. So our project proposal is actually called Defend the Spread because that's our job. As nurses, our job is to make sure our patients are safe, secure, there's no infection spreading. Obviously, when you come into the hospital, make sure you're getting better. We don't want you to get worse. Right. All right, cool. So first slide we have is the table of contents. We have our introduction. So in this presentation, we're going to go over some different things on what I believe are ways that we can stop HAIs or prevent them from happening at all. So we have the introduction, hand hygiene, staff training, project plan, monitoring evaluation, and then obviously our references where we get ideas from. So introduction, what are HAIs in general? HAIs are also known as hospital-acquired infections. These are infections that patients acquire as they're staying in the hospital. So you have your patients on your ventilators, anything invasive, as you see, as like urinary tract infections, surgical site infections, ventilator-associated pneumonia. These things can all happen while you're staying in the hospital. So you might come in with something totally different and acquire one of these diseases. And that's very problematic. And let's get into why. So here are the impacts of HAIs. So the impact of HAIs can have terms such as patient impact, healthcare impact, and worldwide impact. Those are three separate things that we can see. So when it comes to our patients, we can see a prolonged stays. When you get sick and you're already in the hospital, that means you have to stay a little bit longer. It's also an increase in morbidity rates, which means people are more likely to pass away from that because their immune system is already weakened. When it comes to our healthcare system, having an HAI or hospital-acquired infections increases our treatment cost because that's all money that happened that's not covered, essentially. It also puts a strain on hospital availability and resources because that patient who should have left a couple days ago acquired something new and now has to stay for a lot longer. And in severe cases, that patient might need to get upgraded to even ICU, which could cause more resource loss. And globally, when it comes to hospital-acquired infection, that's when we see the development of antibiotic-resistant organisms. Those organisms are stronger and defend more against regular drugs that we use daily. And that's a huge problem because the drugs that we use to treat those don't really work anymore. So what can cause them? Some patient factors that can cause HAIs are weakened immune systems, um, and invasive devices, such as urinary catheters, ventilators, even IV sites. These are all different things that can contribute to hospital-acquired infections. Another thing that as nurses and as healthcare providers that can contribute to this, and these are the hospital factors, is poor hand hygiene. Not going inside as soon as you walk into a room, not getting the hand sanitizer, not disinfecting yourself, making sure you're not having the proper precautions when you're going into different rooms. When it comes to EVS and housekeeping, sometimes not everything is wiped down correctly, and that contaminated equipment, if somebody had a disease prior, can spread to another patient. Along with that, poor infection control protocols. Sometimes nurses or even other health providers, such as LVNs or CNAs, don't know what typical protocols are for infection. That can cause contamination, spread, and other things. So what I propose is a project plan. So what we'd permit is hand hygiene, which be our number one thing, which be implementing a structured hand hygiene protocol, as well as so. For instance, in this scenario, I have as soon as you walk into the room, use the hand sanitizer. As soon as you walk out, use the hand sanitizer. That's just one simple thing that we can do. Making sure you're using appropriate cleaning techniques, especially when you're washing your hands with soap and warm water. Make sure you're getting through all those nice little crevices under your fingernail beds, through the webs of your fingers and other things like that. Those are huge, important things that some nurses might skip over just because they're in a rush or maybe time management, and that can lead to an infection growing because you're not properly being treated. Another thing is cleaning techniques. Regular disinfecting monitor equipment. That's a huge thing. Making sure that the oximeter, making sure that the EKG leads, making sure that even the BP cup, making sure everything is sanitized as soon as they get in. That is a really important thing. Wiping down that room and making sure the bed is clean. There's brand new sheets. All of those things play a role into this, especially the flooring, making sure it's cleaned, it's bleached. All of that stuff matters because when that new patient comes in, they might not have the same level of immune system as the patient beforehand, and something can contract. Another big thing is staff training, implementing more frequent trainings, having that talk about hand hygiene, as well as another thing that I'd like to see implemented is a reward system. If you see other nurses continuing to practice these health safeties, continuing to practice hand hygiene, continuing to practice all these things. That's a great thing, and they should be noticed and recognized for that. Because as small as it may seem, as little as oh, you should always do that, it gets overlooked very easily. And people should be appreciated for the little things. So I think all of those three things, tackling those can reduce the risk of HAIs. So how are we going to monitor and evaluate that? When it comes to monitoring the infection rate, I would say if you implement this plan, going into a 6 month plan, you're able to guide and see if the infection rate decreases through these protocols, through these different implementations, through all of these different project planning. For instance, my project would be mask the spread, increasing the hand hygiene, increasing the monitoring, making sure that other nurses know and they're monitoring, like, hey, look, keeping each other accountable is a really big thing. I have it right here too. Holding each other accountable. Like, let's see if you see a fellow nurse not properly sanitizing their hands, or if they have a C. diff patient not properly washing their hands, letting them know, hey, man, look, you got to do that. That's something that, although our goal is not to get each other in trouble, it's something that could save somebody's life. So that's something we can monitor. I think monitoring infection rates from the beginning of the implementation is a really big thing because you can see the graph. You can see the change in direction if it's trending upwards, if it's trending downwards, and that's how you can make modifications. But like I said, auditing and monitoring units, that's a huge thing. Making sure that those units know that they're being watched, mean they're being monitored, they're being understood, that's holding nurses accountable. That's holding LVNs, CNAs, doctors all accountable. That's a really big thing. Because if no one's being held accountable, then how do we know these things are really working? Especially monitoring how equipment is sanitized, ensuring that we're making sure that EVS or house cleaning is making sure that they're cleaning that whole room. I know they have a really busy schedule and this and that, or even if as nurses we can help them out, but ensuring that all the equipment is sanitized and clean and not contaminated is a really huge thing that we can do. Those are just some of the ways we can evaluate that. HCIs are a really major problem, and I'd like to see them reduce. Because when you go to the hospital, we expect you to get better, not worse. That's not our goal. And here are my references. Thank you for watching. I appreciate you. Bye bye.